So this video is about breathing techniques and how to assess yourself and to perform a breathing exercise. So what we find with a vast amount of clients these days is they are breathing incorrectly. Now, I know that might sound strange, but it does matter. We're actually designed to breathe from the belly, or from the diaphragm more precisely. So what happens is, as you breathe in, your belly comes out, your diaphragm, which is the muscle inside the rib cage, comes down and it sucks the oxygen into your lungs. When you breathe back out, belly comes back in, diaphragm comes up and forces the oxygen back out. Now what we find in a lot of clients these days, and they come in for various reasons, one of the first things we now check is their breathing, and predominantly people are breathing from their chest. Now, as I said, we're designed to breathe from the diaphragm. Now that can become what we call facilitated or basically stuck for various reasons, and that can be from physical or emotional stress. So you actually perform shallow breathing, so the diaphragm is not being used. I've had clients that work in a service industry where they're around a lot of people all the time, and maybe they've got a little bit of excess around the stomach area, so they hold themselves in while they're at work. Now you're talking, between 8 and 10 hours a day. And also people, when they go on holiday, maybe they're not as trim as they want to be, so they hold themselves in for 2 weeks. Now, if you hold yourself in, the diaphragm can't come down efficiently enough, so you're not able to breathe correctly. So your body then says, well, I have to breathe somehow, what do I do? Well, what we've got is some accessory muscles down the side of the neck onto the ribs called the scalenes, amongst others. Now, as I said, these are accessory muscles and they're supposed to help out with breathing, not perform the main duty of breathing. You've also, down these sides of the spine, got another pair of muscles called the quadratus lumborum, or the QLs. Now these attach to your lowest rib and then your pelvis, and they pull the rib cage down, or they pull the bottom rib down to help get more oxygen into the lungs. Now they can only do this if the diaphragm is breathing, is working correctly. So if the diaphragm is not, you've got these QLs in your low back, constantly trying to pull down, so they become tense and you get back pain. Now, obviously there are other issues associated with back pain, but in terms of breathing, if you're breathing correctly, it's quite common that you'll have back pain. The scalenes are down the side of the neck, again, doing most of the work for your breathing, then they're going to be chronically overused, causing tension in the neck. This can lead to headaches. You're more than likely, not always, but quite likely to be quite fatigued most of the time. You're going to be a shallow breather. You may have trouble concentrating. You may have quite a lot of muscle tension, and obviously back pain, as we just mentioned. So it is very important that we get you breathing correctly, and it may not be the overall problem that you have or the cause of your problem, but if you're breathing correctly, that needs to be addressed regardless. So we'll hold on a fair bit now. I need to give you some background in why we need to address this. So, laying on the floor, if I put a hand on the stomach or the belly button and one hand on the chest, what we're looking for is, on a deep breath, is the belly rising about 2/3 and the last third from the chest, if at all. So there should be virtually no movement of the hand on the chest, or if there is, it's right at the end. Now this is exaggerated breathing, so in normal life you wouldn't be doing that all the time, but this is an exercise to get you breathing correctly, so that when you are in a normal environment, you're breathing from your belly. It's not going anywhere near as high as it was before, but you're breathing from there. So what we're looking for is mouth closed, teeth apart, tongue on the top of your palate or behind your top teeth, breathing in and out through your nose. So you shouldn't use your mouth for breathing, in and out through the nose. We're looking for a double length of time for the exhalation against the inhalation. So basically, that's, say you breathe in over 3 seconds, you should be breathing out over around about 6 seconds. Again, only through your nose. Breathing in and out through your nose, teeth apart, tongue on the top of your teeth or your palate, lips closed, only breathing through your nose. So again, sometimes I get a client to put a light weight, 5 kilos or so, on the stomach, hold it on the stomach and push the weight up into the air. So a kettlebell or a lightish weight anyway. Okay, when you've got that almost a second nature, what we're looking for then is to get some sideways or lateral movement of the breathing as well. So you can put your hands lightly on the side of the ribs and still focus on breathing through the belly, but also trying to push the rib cage out with your hands. Now you're not pushing in hard, you're just resting the hands on the sides of your ribs, breathing through the belly, and focus on pushing the ribs out into your hands as well. So that will use the costal muscles of the ribs to aid breathing as well. So what you might find as well is that if you've come for a treatment and we found this, you may find that your diaphragm is quite tender. So again, better flying down, put your fingertips on the border of your ribs, scoop underneath the ribs, and you may find it's very uncomfortable. Mainly the right side, but it can be both. But it's usually the right is more, so it might be right across. So if that's the case, we'll have told you to check out the diaphragm release video first. But the main thing is to get breathing and get breathing properly.